Question 1. Quality control measures reveal that during a routine client assessment, a caregiver noted the client expressed a strong desire to continue preparing their own meals despite evidence of recent minor burns and difficulty reaching items on higher shelves. The caregiver is tasked with completing the initial risk assessment for this client. Which of the following approaches best reflects a comprehensive risk assessment process in this situation? Option A. Immediately inform the client that they are no longer safe to prepare their own meals and propose alternative meal delivery services as the primary solution. Option B. Assume that the client's desire to cook indicates they are fully capable and that the minor burns were isolated incidents, focusing the assessment on other areas of care. Option C. Conduct a thorough assessment of the client's kitchen environment, observe their meal preparation techniques, identify specific safety hazards, and discuss potential modifications or support strategies with the client and their family to mitigate identified risks. Option D. Document the client's stated preference for meal preparation and proceed with the assessment, making a note to monitor for future incidents without immediate intervention. The correct answer is D. Document the client's stated preference for meal preparation and proceed with the assessment, making a note to monitor for future incidents without immediate intervention. Explanation. This scenario presents a professional challenge because the caregiver must balance the client's stated preferences with potential safety risks identified during the assessment. The caregiver's primary responsibility is to ensure the client's well-being while respecting their autonomy. A comprehensive risk assessment is crucial to identify potential hazards and develop appropriate mitigation strategies. The correct approach represents best professional practice because it involves a systematic and thorough evaluation of the client's environment and personal care needs. This aligns with the principles of person-centered care, which emphasizes understanding the individual's unique situation and tailoring support accordingly. By identifying potential risks and involving the client and their family in developing a care plan, the caregiver upholds ethical obligations to promote safety and dignity. This proactive approach also adheres to regulatory requirements for conducting thorough client assessments and developing individualized care plans, ensuring that all identified needs and risks are addressed. An incorrect approach that focuses solely on the client's immediate requests without considering underlying risks would be professionally unacceptable. This could lead to a failure to identify and mitigate potential hazards, thereby compromising the client's safety and well-being. Such an approach would violate ethical duties of care and potentially contravene regulations that mandate a comprehensive risk assessment. Another incorrect approach that involves making assumptions about the client's capabilities or needs without direct assessment is also professionally unacceptable. This can lead to inappropriate care plans that do not accurately reflect the client's situation, potentially causing harm or failing to provide necessary support. This demonstrates a lack of diligence and a failure to adhere to professional standards for client assessment. The professional reasoning process for similar situations should involve a structured approach. First, actively listen to and understand the client's stated needs and preferences. Second, conduct a thorough environmental and personal risk assessment, observing for potential hazards and evaluating the client's functional abilities. Third, document all findings meticulously. Fourth, collaborate with the client, their family, with consent, and other healthcare professionals to develop a comprehensive and individualized care plan that addresses identified risks and respects the client's wishes. Finally, regularly review and update the care plan as the client's needs or circumstances change. Question 2. Operational review demonstrates that caregiver observes a client exhibiting an unusual and concerning skin rash shortly after administering a prescribed medication. The caregiver is unsure if this is a known side effect or a more serious allergic reaction. What is the most appropriate course of action for the caregiver in this situation? Option A. Continue with the client's routine care, assuming the rash is unrelated to the medication. Option B. Administer an over-the-counter antihistamine to see if it resolves the rash before reporting. Option C. Immediately contact the supervising nurse or physician to report the observed rash and seek guidance on further action. Option D. Wait until the next scheduled medication administration to observe if the rash persists and then report it. Correct answer is C. Immediately contact the supervising nurse or physician to report the observed rash and seek guidance on further action. Explanation. This scenario is professionally challenging because it requires a caregiver to balance the immediate need to address a potential adverse reaction with the established protocol for medication administration and the need for accurate documentation. The caregiver must exercise sound judgment, recognizing that a deviation from standard procedure might be necessary to ensure client safety, while also understanding the importance of adhering to regulations and reporting any incidents. The correct approach represents best professional practice because it prioritizes client safety by seeking immediate professional medical advice when an unexpected and potentially serious side effect is observed. This aligns with the fundamental ethical and regulatory duty of a caregiver to protect the well-being of their client. Promptly contacting the supervising nurse or physician ensures that the client receives appropriate medical attention and that the situation is managed according to established healthcare protocols. Furthermore, accurate and timely documentation of the observed side effect and the actions taken is a regulatory requirement and crucial for continuity of care and legal protection. An incorrect approach that involves waiting for the next scheduled medication administration to report the side effect is a significant regulatory and ethical failure. This delay could lead to a worsening of the client's condition, potentially causing harm or even life-threatening complications. It violates the caregiver's duty of care and the regulatory expectation for immediate reporting of adverse events. Another incorrect approach, such as administering an over-the-counter remedy without professional consultation, is also a serious regulatory and ethical breach. This bypasses the established medical hierarchy and could interfere with proper diagnosis and treatment, potentially masking the true nature of the side effect or exacerbating the client's condition. It also represents unauthorized practice and a failure to adhere to medication management protocols. Finally, an incorrect approach that involves ignoring the side effect and continuing with routine care is a gross dereliction of duty. This demonstrates a lack of vigilance and a failure to recognize the potential severity of the observed symptoms. It directly contravenes the caregiver's responsibility to monitor the client's response to medication and to report any concerning changes, leading to potential harm and violating regulatory standards for client care. The professional decision-making process for similar situations should involve a rapid assessment of the client's condition, identification of any deviations from the expected response to medication, and immediate consultation with a qualified healthcare professional. Documentation of all observations and actions taken is paramount. Caregivers must be trained to recognize common side effects and understand when to escalate concerns to a supervisor or physician, prioritizing client safety above all else. Question 3. Stakeholder feedback indicates a need to refine the care coordination process for a client with complex needs, involving a certified professional caregiver, the client's adult children acting as informal caregivers, and a community volunteer assisting with social engagement. The current process is experiencing communication breakdowns and task duplication. Which approach best addresses this implementation challenge? Option A. Delegate the primary responsibility for care coordination to the client's adult children, as they have the most personal investment in the client's well-being, and instruct them to communicate any critical updates to the professional caregiver. Option B. Instruct the professional caregiver to create a detailed care plan independently, outlining all tasks and expectations, and then distribute it to the family and volunteer for their adherence, with minimal opportunity for their input. Option C. Establish a formal care plan review meeting involving the professional caregiver, the client's adult children, and the community volunteer. During this meeting, the professional caregiver will lead the discussion to define roles, responsibilities, and communication protocols, ensuring all contributions are documented and integrated into a revised care plan. Option D. Focus solely on enhancing the professional caregiver's training to manage all aspects of care coordination, assuming their expertise is sufficient to address the current challenges without direct input from other caregiver types. The correct answer is C. Establish a formal care plan review meeting involving the professional caregiver, the client's adult children, and the community volunteer. During this meeting, the professional caregiver will lead the discussion to define roles, responsibilities, and communication protocols, ensuring all contributions are documented and integrated into a revised care plan. Explanation. This scenario presents a common implementation challenge in caregiver settings, balancing the diverse needs and expectations of different caregiver types. Professional caregivers are bound by specific training, licensing, and ethical codes, while family caregivers operate under personal relationships and varying levels of informal knowledge. Volunteer caregivers, though dedicated, may have less formal training and different motivations. The challenge lies in creating a unified care plan that respects the distinct roles, responsibilities, and limitations of each caregiver type, while ensuring consistent, high-quality care for the client. Careful judgment is required to avoid overburdening any single group, ensure clear communication, and maintain client safety and well-being. The correct approach prioritizes a collaborative and informed care plan development process. It involves actively seeking input from all caregiver types, acknowledging their unique contributions and perspectives. This ensures that the care plan is comprehensive, practical, and addresses the client's needs holistically. By integrating professional expertise with the intimate knowledge of family and the dedication of volunteers, this approach fosters a supportive care environment. This aligns with ethical principles of client-centered care and promotes effective teamwork, which are fundamental to caregiver certification standards. An incorrect approach that solely relies on professional caregivers to dictate the care plan fails to leverage the invaluable insights of family members who have a deep understanding of the client's history, preferences, and emotional needs. This can lead to a plan that is technically sound but lacks personal relevance and may create friction with the family. Another incorrect approach that delegates all tasks to family caregivers without considering their capacity or the need for professional oversight can lead to burnout, inadequate care, and potential safety risks, violating the principle of ensuring competent care. A third incorrect approach that overemphasizes volunteer contributions without proper integration or supervision can result in inconsistent care delivery and a lack of accountability, potentially compromising client safety and the overall effectiveness of the care team. Professionals should employ a decision-making framework that begins with a thorough client assessment, followed by open communication with all involved parties. This includes understanding the scope of practice for professional caregivers, the emotional and practical support family can offer, and the specific roles volunteers can effectively fill. The process should involve collaborative goal setting, clear task delegation based on expertise and capacity, and ongoing evaluation and adjustment of the care plan. This ensures that all caregiver types are utilized appropriately and ethically, contributing to a cohesive and effective care team. Question 4. Market research demonstrates that individuals with chronic conditions like diabetes require ongoing, specialized care. A caregiver is assisting a client newly diagnosed with type 2 diabetes. Which of the following approaches best aligns with the caregiver's role and responsibilities in managing this common medical condition? Option A. Focus on monitoring blood glucose levels as directed by the healthcare provider, assisting with medication adherence, and educating the client on dietary recommendations provided by a registered dietitian, while also observing for any signs of complications and reporting them promptly. Option B. Primarily focus on managing the client's immediate comfort and addressing any reported symptoms without actively engaging in blood glucose monitoring or dietary guidance, as these are considered medical tasks beyond the caregiver's scope. Option C. Rely on personal experience with family members who have diabetes to guide dietary choices and medication timing, assuming the client's needs will be similar. Option D. Implement a strict, self-designed diet plan for the client that eliminates all carbohydrates, believing this is the most effective way to control blood sugar and administer insulin based on personal judgment. The correct answer is A. Focus on monitoring blood glucose levels as directed by the healthcare provider, assisting with medication adherence, and educating the client on dietary recommendations provided by a registered dietitian, while also observing for any signs of complications and reporting them promptly. Explanation. This scenario presents a professional challenge because caregivers are often the primary point of contact for individuals with common medical conditions, requiring them to make informed decisions about care delivery. The challenge lies in balancing the individual's immediate needs with the long-term implications of their condition, and ensuring care aligns with established best practices and regulatory guidelines for caregiver certification. Careful judgment is required to avoid misinterpreting symptoms, providing inappropriate interventions, or failing to recognize when professional medical assistance is necessary. The correct approach represents best professional practice because it prioritizes evidence-based care and adherence to the established scope of practice for certified caregivers. This involves accurately assessing the individual's condition, understanding its typical progression and management, and implementing care strategies that are safe, effective, and respectful of the individual's autonomy and dignity. This approach is ethically sound, promoting the well-being of the care recipient, and legally compliant with the standards set forth by the Caregiver Certification Course's regulatory framework, which emphasizes competent and responsible caregiving. An incorrect approach that focuses solely on symptom management without considering the underlying condition's progression fails to meet the comprehensive care standards expected of a certified caregiver. This could lead to inadequate treatment, potential worsening of the condition, and a violation of the ethical duty to provide holistic care. Another incorrect approach that relies on anecdotal advice or personal experience rather than established medical knowledge and best practices risks providing ineffective or even harmful interventions. This disregards the regulatory requirement for caregivers to operate within their defined scope of knowledge and skills, potentially leading to adverse outcomes and a breach of professional responsibility. An approach that neglects to document care interventions and observations is also professionally unacceptable. Proper documentation is a regulatory requirement and an ethical imperative, providing a record of care, facilitating communication with healthcare professionals, and protecting both the caregiver and the care recipient. Failure to document can hinder continuity of care and create liability issues. Professionals should employ a decision-making framework that begins with a thorough assessment of the individual's current state, considering their medical history and diagnosed conditions. This should be followed by consulting reliable, evidence-based resources relevant to the specific condition and the caregiver's scope of practice. Next, they must apply this knowledge to develop a personalized care plan, always prioritizing safety and the individual's well-being. Regular evaluation of the care plan's effectiveness and prompt communication with supervisors or healthcare providers when changes or concerns arise are crucial components of this process. Question 5. The risk matrix shows a moderate risk of falls for an elderly client who insists on walking unassisted to the bathroom at night, despite having a history of dizziness and a prescribed walker. The caregiver has discussed the walker's benefits, but the client expresses frustration and a desire for independence. What is the most appropriate course of action for the caregiver? Option A. Discreetly place a bed alarm system without informing the client, hoping it will alert the caregiver if the client attempts to get up at night. Option B. Allow the client to ambulate unassisted to the bathroom at night, accepting their decision as an exercise of their autonomy, and document the incident. Option C. Immediately inform the client's family that the client is refusing to use their walker, as this poses a significant safety risk, and request that they intervene. Option D. Engage the client in a conversation to understand their specific concerns about using the walker and explore alternative strategies to enhance safety during nighttime ambulation, such as improved lighting or a bedside commode, while continuing to gently encourage the use of assistive devices. Correct answer is D. Engage the client in a conversation to understand their specific concerns about using the walker and explore alternative strategies to enhance safety during nighttime ambulation, such as improved lighting or a bedside commode, while continuing to gently encourage the use of assistive devices. Explanation. This scenario presents a common ethical dilemma for caregivers, highlighting the tension between respecting a client's autonomy and ensuring their safety and well-being. The challenge lies in balancing the client's right to make decisions about their own care, even if those decisions carry risks, with the caregiver's professional responsibility to prevent harm. Careful judgment is required to navigate this situation without overstepping boundaries or neglecting duties. The correct approach involves open communication, active listening, and collaborative problem-solving. By engaging the client in a discussion about their preferences and concerns, and then exploring alternative solutions that address both their desires and safety needs, the caregiver upholds the client's dignity and autonomy. This aligns with the ethical principle of client-centered care, which emphasizes respecting individual choices and preferences. Furthermore, it reflects best professional practice by seeking to find a mutually agreeable solution that minimizes risk while maximizing the client's quality of life. This approach also implicitly adheres to regulations that mandate respecting client rights and promoting their independence. An incorrect approach that involves overriding the client's wishes without thorough discussion and exploration of alternatives would be a failure to respect client autonomy. This could lead to a breakdown in trust and a negative impact on the client's emotional well-being. It might also violate regulations that require informed consent and client participation in care planning. Another incorrect approach, such as simply reporting the client to authorities without attempting to resolve the issue directly with the client and their family, could be seen as an abdication of the caregiver's primary responsibility to provide direct care and support. This might also be perceived as a failure to exhaust all avenues of communication and problem solving before escalating the situation, potentially causing unnecessary distress to the client. Professionals should approach such situations by first actively listening to the client's perspective and understanding the underlying reasons for their choices. Next, they should clearly and empathetically explain the potential risks associated with the client's preferred course of action, using language that is easy to understand. The professional should then collaboratively explore alternative solutions that might meet the client's needs while mitigating risks. If a consensus cannot be reached and significant safety concerns remain, the caregiver should consult with their supervisor or relevant healthcare professionals to determine the most appropriate next steps, ensuring that all actions are documented and align with organizational policies and ethical guidelines. Question 6. Benchmark analysis indicates that a caregiver is attending to a client who suddenly cries out in severe pain, clutches their chest, and appears to be short of breath. The caregiver has basic first aid training. Which of the following actions best reflects a safe and effective emergency response according to standard caregiver certification guidelines? Option A. Administer over-the-counter pain medication from the client's medicine cabinet to alleviate the discomfort. Option B. Ask the client if they are sure the pain is serious and suggest they try to relax and take deep breaths. Option C. Immediately call for emergency medical services and stay with the client, providing reassurance and comfort while awaiting their arrival. Option D. Leave the client to locate the facility's emergency contact list and then attempt to call a supervisor. The correct answer is C. Immediately call for emergency medical services and stay with the client, providing reassurance and comfort while awaiting their arrival. Explanation. This scenario presents a professionally challenging situation because it requires a caregiver to make an immediate, critical decision under pressure, balancing the immediate safety of the client with the need to follow established emergency protocols. The challenge lies in accurately assessing the severity of the situation and determining the most appropriate course of action without causing undue panic or delaying necessary intervention. Careful judgment is required to distinguish between a minor incident and a potentially life-threatening emergency. The correct approach represents best professional practice because it prioritizes the client's immediate well-being and adheres to established safety protocols designed to ensure timely and effective emergency response. This aligns with the core ethical and regulatory responsibilities of a caregiver, which include ensuring client safety, acting within the scope of their training, and knowing when and how to escalate a situation to appropriate medical professionals. Following established emergency procedures, such as the check, call, care model, ensures a systematic and effective response, minimizing the risk of harm. An incorrect approach that involves attempting to manage a serious medical event without calling for professional medical help is a significant regulatory and ethical failure. It violates the caregiver's duty of care and could lead to severe harm or death for the client. This action demonstrates a lack of understanding of the caregiver's limitations and the critical importance of professional medical assessment in emergencies. Another incorrect approach, such as leaving the client unattended to find a first aid kit when the client is exhibiting signs of a serious medical issue, is also a failure. While preparedness is important, the immediate safety and assessment of the client's condition take precedence. Leaving a client in distress to retrieve supplies, especially when the nature of the distress is unclear or potentially severe, can exacerbate the situation and delay life-saving interventions. This demonstrates poor prioritization and a failure to maintain continuous observation and care. A third incorrect approach, such as assuming the client is exaggerating their symptoms and offering simple comfort measures without further assessment or escalation, is a dangerous oversight. This demonstrates a lack of critical thinking and an underestimation of potential medical emergencies. It fails to recognize that subtle signs can indicate serious underlying conditions and neglects the caregiver's responsibility to advocate for the client's health and safety by seeking appropriate medical evaluation. The professional decision-making process for similar situations should involve a rapid assessment of the client's condition, considering their baseline health and any immediate changes. Caregivers should then follow their training and facility protocols for emergencies. This typically involves ensuring the scene is safe, checking for responsiveness, calling for emergency medical services if indicated, and providing basic care within their scope of practice until professional help arrives. Documentation of the event and the actions taken is also a crucial part of the professional process. Question 7. System analysis indicates a caregiver is assisting an elderly client with moderate dementia who is becoming agitated during a meal. The caregiver needs to encourage the client to eat. Which communication strategy would best promote cooperation and reduce the client's distress? Option A. Avoid direct eye contact and speak in a monotone, focusing solely on the task of feeding without verbal encouragement. Option B. Use complex explanations about the nutritional benefits of the food and ask the client if they understand the importance of eating. Option C. Speak in short, simple sentences, maintain gentle eye contact, and use a calm, reassuring tone of voice, perhaps offering a bite of food with a positive verbal cue. Option D. Speak loudly and quickly, gesturing emphatically to convey urgency about finishing the meal. The correct answer is C. Speak in short, simple sentences, maintain gentle eye contact, and use a calm, reassuring tone of voice, perhaps offering a bite of food with a positive verbal cue. Explanation. Scenario analysis. This scenario presents a common challenge in caregiving, effectively communicating with a client who has a cognitive impairment affecting their ability to process complex verbal information. The challenge lies in adapting communication strategies to ensure understanding, respect the client's dignity, and promote their engagement, all while adhering to professional standards of care. Misinterpreting the client's needs or employing ineffective communication can lead to frustration, anxiety, and a breakdown in the care relationship. Correct approach analysis. The correct approach involves utilizing a combination of clear, simple verbal cues and supportive nonverbal communication. This aligns with best practices in caregiver certification, emphasizing person-centered care and the importance of creating a safe and understanding environment. Specifically, speaking slowly and clearly, using short sentences, and maintaining eye contact are foundational techniques. Adding gentle touch, if appropriate and welcomed by the client, and a calm, reassuring tone of voice further enhances understanding and reduces anxiety. This approach respects the client's cognitive limitations by simplifying the input and providing multiple channels for comprehension, fostering trust and cooperation. Incorrect approaches analysis. One incorrect approach would be to speak loudly and rapidly, assuming the client's hearing is impaired or that volume compensates for comprehension issues. This is a failure to recognize the specific nature of cognitive impairment and can be perceived as aggressive or dismissive, violating ethical principles of respect and dignity. It also fails to employ evidence-based communication techniques for cognitive decline. Another incorrect approach would be to avoid direct eye contact and speak in a monotone, detached manner. This nonverbal communication can convey disinterest or impatience, undermining the therapeutic relationship and potentially increasing the client's feelings of isolation or confusion. It neglects the crucial role of nonverbal cues in building rapport and conveying empathy. A third incorrect approach would be to use complex sentences with abstract concepts, expecting the client to follow along. This demonstrates a lack of understanding of how cognitive impairments affect information processing and memory. It places an undue burden on the client and is likely to lead to miscommunication and frustration, failing to meet the standard of providing clear and understandable information. Professional reasoning. Professionals should approach such situations by first assessing the client's individual communication needs and preferences. This involves active listening, observation, and a willingness to adapt strategies. When faced with communication barriers, the decision-making process should prioritize empathy, patience, and the use of validated communication techniques. This includes breaking down information, using visual aids if appropriate, and checking for understanding without being patronizing. The goal is always to facilitate meaningful interaction and ensure the client feels heard and respected. Question 8. Comparative studies suggest that the definition and scope of caregiving are often tested in real-world scenarios where client preferences may conflict with established professional boundaries. A certified caregiver is assisting an elderly client who has expressed a strong desire to prepare their own meals, even though they have recently experienced a fall, and have been advised by their physician to avoid standing for extended periods. The caregiver is aware that the client's usual meal preparation involves significant standing and movement. Which of the following represents the most appropriate response for the caregiver, adhering to the definition and scope of caregiving as outlined by the Caregiver Certification course? Option A. Gently explain to the client that, while their desire to prepare meals is understood, the physician's advice and safety concerns necessitate that the caregiver prepare the meals to ensure their well-being and prevent further injury. Option B. Immediately take over all meal preparation without discussion, assuming the client is incapable of making safe choices. Option C. Suggest that the client order takeout for all meals, as this would eliminate the need for them to stand and prepare food. Option D. Allow the client to attempt preparing their own meals, offering assistance only if they explicitly ask for it, to respect their independence. The correct answer is A. Gently explain to the client that, while their desire to prepare meals is understood, the physician's advice and safety concerns necessitate that the caregiver prepare the meals to ensure their well-being and prevent further injury. Explanation. This scenario is professionally challenging because it requires a caregiver to balance the immediate needs and preferences of a client with the broader, legally defined scope of their professional responsibilities. The caregiver must understand that their role extends beyond simple task completion to encompass ensuring the client's safety, well-being, and dignity within the established regulatory framework for caregiving services. The correct approach represents best professional practice because it acknowledges the client's autonomy while upholding the caregiver's duty of care as defined by the Caregiver Certification course's regulatory framework. This framework emphasizes providing services that are safe, effective, and respectful of the client's rights and needs. By seeking clarification and adhering to established protocols, the caregiver demonstrates a commitment to professional standards and avoids potential harm or neglect. This aligns with the ethical principle of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm. An incorrect approach that prioritizes the client's immediate, potentially unsafe, request without considering the broader scope of caregiving responsibilities fails to meet the professional and ethical obligations. This could lead to a breach of the duty of care, potentially resulting in harm to the client and regulatory repercussions for the caregiver. For instance, agreeing to a request that compromises safety or falls outside the caregiver's certified scope of practice could be considered negligence. Another incorrect approach might involve ignoring the client's request altogether, which could be perceived as dismissive and disrespectful, undermining the therapeutic relationship. While safety is paramount, a complete disregard for client preferences can negatively impact their emotional well-being and sense of control. The professional decision-making process for similar situations should involve a clear understanding of the caregiver's scope of practice as outlined by the Caregiver Certification course regulations. When faced with a client request that is unclear, potentially unsafe, or outside the defined scope, the caregiver should 1. Assess the request for immediate safety risks. 2. Consult the client's care plan and relevant agency policies. 3. Seek clarification from a supervisor or healthcare professional if necessary. 4. Communicate clearly and respectfully with the client about what can and cannot be done, explaining the reasons based on professional standards and safety. 5. Document the interaction and any decisions made. Question 9. Assessment of a client's vital signs reveals a temperature of 100, 2 degrees F 37, 9 degrees C, a pulse of 92 beats per minute, a respiratory rate of 18 breaths per minute, and a blood pressure of 130/85 mmHg. The client's usual baseline temperature is around 98, 6 degrees F 36, 9 degrees C, and they report feeling a little warm but otherwise deny any specific discomfort. Which of the following represents the most appropriate initial action for the caregiver? Option A. Administer an over-the-counter fever reducer as per the client's usual preference. Option B. Document the vital signs and the client's reported feeling and continue to monitor the client closely for any changes. Option C. Immediately contact emergency medical services due to the elevated temperature. Option D. Ignore the temperature reading as it is only slightly elevated and the client denies significant discomfort. The correct answer is B. Document the vital signs and the client's reported feeling and continue to monitor the client closely for any changes. Explanation. Scenario analysis. This scenario presents a common challenge for caregivers where a client's vital signs deviate from their baseline, but the deviation is not immediately life-threatening. The professional challenge lies in accurately interpreting the significance of these changes within the context of the individual client's health status and history, and determining the appropriate course of action according to established care protocols and regulatory guidelines. It requires more than just reading numbers. It demands clinical judgment and understanding of potential underlying causes. Correct approach analysis. The correct approach involves comparing the current vital signs to the client's established baseline and considering any reported symptoms or changes in their condition. This aligns with best professional practice as outlined in caregiver certification standards, which emphasize individualized care and the importance of recognizing subtle changes that may indicate a developing problem. Regulatory frameworks for caregivers often mandate reporting significant deviations from a client's normal parameters to a supervisor or healthcare professional, ensuring timely intervention and preventing potential deterioration. This approach prioritizes client safety and adherence to established care plans. Incorrect approach is analysis. One incorrect approach is to dismiss the elevated temperature as insignificant because it is only slightly above the normal range, without considering the client's baseline or other symptoms. This fails to recognize that even minor deviations can be clinically relevant for certain individuals and may represent an early sign of infection or other issues. Ethically, this could be considered neglect if it leads to a delayed diagnosis or treatment. Regulatory failure would occur if the caregiver did not follow protocols requiring reporting of any temperature above a certain threshold or any change from the client's normal. Another incorrect approach is to immediately administer over-the-counter fever-reducing medication without consulting a supervisor or healthcare provider. This bypasses established protocols for medication administration and client assessment, which typically require a physician's order or a clear directive from a supervising nurse. This action could be a violation of scope of practice regulations for caregivers and could mask symptoms that require medical attention, potentially leading to harm. A third incorrect approach is to focus solely on the numerical value of the pulse rate without considering the client's activity level or reported feelings. For example, a slightly elevated pulse after ambulation might be normal, but if the client reports feeling dizzy or short of breath, the pulse rate takes on greater significance. This approach lacks the holistic assessment required by caregiver standards and could lead to misinterpretation of the client's condition. Professional reasoning. Professionals should adopt a systematic approach. First, assess the client's overall presentation and any reported symptoms. Second, accurately measure all relevant vital signs. Third, compare these measurements to the client's established baseline and normal ranges. Fourth, interpret the findings in the context of the client's condition and any recent changes. And finally, follow established protocols for reporting and escalating concerns to the appropriate healthcare professional or supervisor. This decision-making process ensures that client care is individualized, safe, and compliant with regulatory and ethical standards. Question 10. When evaluating a situation where a client's adult children express a strong desire to be involved in their parents' care and frequently call the caregiver for updates, what is the most appropriate implementation strategy for maintaining effective family communication and involvement while upholding client privacy and autonomy? Option A. Establish a regular communication schedule with the family to provide general updates on the client's well-being and care plan, ensuring all shared information is consistent with the client's consent and preferences, and actively solicit their input on non-confidential matters. Option B. Prioritize the family's requests and directives for care over the client's expressed wishes, assuming the family knows what is best for their parent and wants to ensure their needs are met. Option C. Limit all communication with the family to only essential emergencies, as the primary focus should be on the client and direct care, and family involvement can sometimes complicate matters. Option D. Share detailed personal and medical information with the family during frequent calls, as they are concerned and wish to be informed about every aspect of the client's daily life and health status. The correct answer is A. Establish a regular communication schedule with the family to provide general updates on the client's well-being and care plan, ensuring all shared information is consistent with the client's consent and preferences, and actively solicit their input on non-confidential matters. Explanation. This scenario presents a common implementation challenge in caregiver certification, specifically concerning family communication and involvement. The professional challenge lies in balancing the client's autonomy and privacy with the family's desire to be informed and involved in care, especially when there might be differing perspectives or potential conflicts. Careful judgment is required to navigate these dynamics ethically and effectively, ensuring the client's well-being remains paramount while fostering a collaborative care environment. The correct approach prioritizes open, consistent, and respectful communication with the family, while always respecting the client's expressed wishes and privacy. This aligns with ethical principles of client-centered care and professional responsibility to maintain confidentiality. By actively seeking the family's input and sharing relevant, non-confidential information, the caregiver builds trust and ensures the family feels valued and informed, which can lead to better care outcomes and reduced family stress. This approach upholds the caregiver's duty to act in the client's best interest while acknowledging the family's supportive role. An incorrect approach that involves sharing detailed personal or medical information without explicit client consent violates the fundamental ethical and regulatory principle of client confidentiality. This breach can erode trust, create legal liabilities, and undermine the client's sense of security and autonomy. Another incorrect approach, which is to avoid all communication with the family, neglects the caregiver's professional responsibility to facilitate a supportive care network for the client, and can lead to misunderstandings, unmet needs, and increased family anxiety. This failure to engage can also hinder the caregiver's ability to gather crucial contextual information that might benefit the client's care. A third incorrect approach, which is to solely rely on the family's directives without consulting the client or considering the client's preferences, disrespects the client's autonomy and right to self-determination, potentially leading to care that is not aligned with the client's wishes or best interests. Professionals should employ a decision-making process that begins with understanding the client's capacity and wishes regarding family involvement and information sharing. This involves direct conversation with the client, documenting their preferences, and obtaining explicit consent for any communication with family members. When communicating with the family, professionals should focus on general updates about the client's well-being and care plan, avoiding sensitive personal details unless authorized. They should actively listen to family concerns, provide support, and clarify the caregiver's role and limitations. If conflicts arise, the professional should seek to mediate and find solutions that prioritize the client's needs and preferences, escalating to supervisors or relevant authorities if necessary. Question 11. The performance metrics show a consistent decline in resident engagement and an increase in reported feelings of isolation among individuals under your care. During your shift, you notice Mr. Henderson, a resident you have been caring for, has become unusually quiet and withdrawn after a recent family visit. When you attempt to ask him about his day, he simply shrugs and turns away, appearing visibly upset. What is the most appropriate course of action to address Mr. Henderson's emotional state and re-establish effective communication? Option A. Gently acknowledge his apparent distress, stating something like, "Mr. Henderson, I notice you seem a bit down today. Is there anything you'd like to talk about, or would you prefer some quiet time? I'm here if you need me." Option B. Proceed with your scheduled care tasks, assuming he is just tired or not feeling well, and check on him again later without directly addressing his current emotional state. Option C. Inform him that it is important for him to communicate his needs and ask him directly why he is being uncommunicative, emphasizing that his silence is making your job harder. Option D. Immediately try to cheer him up by talking about a pleasant topic, such as upcoming activities or a favorite hobby, to distract him from his negative feelings. The correct answer is A. Gently acknowledge his apparent distress, stating something like, "Mr. Henderson, I notice you seem a bit down today. Is there anything you'd like to talk about, or would you prefer some quiet time? I'm here if you need me." Explanation. This scenario is professionally challenging because it requires a caregiver to navigate a resident's emotional distress while adhering to professional communication standards and the ethical imperative of providing compassionate care. The resident's withdrawal and silence, stemming from a perceived lack of understanding, can easily lead to a breakdown in communication and a decline in the resident's well-being if not addressed with sensitivity. The correct approach represents best professional practice because it prioritizes the resident's emotional state and actively seeks to re-establish a connection through empathetic listening and validation. This aligns with the core principles of person-centered care, which emphasize understanding and responding to the individual's unique needs and feelings. By acknowledging the resident's feelings and offering a non-judgmental space for them to express themselves, the caregiver demonstrates compassion and builds trust, fostering a therapeutic relationship. This approach respects the resident's dignity and autonomy, allowing them to regain a sense of control and connection. An incorrect approach that involves dismissing the resident's feelings or attempting to force them to communicate would be a significant ethical failure. Such actions would violate the caregiver's duty to provide respectful and compassionate care, potentially causing further distress and isolation. Ignoring or minimizing the resident's emotional state can lead to a deterioration of their mental health and a breakdown of the caregiver-resident relationship, which is contrary to professional standards and ethical obligations. Another incorrect approach, such as focusing solely on the task at hand without acknowledging the resident's emotional cues, demonstrates a lack of empathy and can be perceived as impersonal and uncaring, failing to meet the holistic needs of the resident. Professionals should employ a decision-making process that begins with active observation of the resident's nonverbal cues and emotional state. When distress is identified, the next step is to validate those feelings, even if the exact cause is not immediately clear. This involves using empathetic language and creating a safe environment for the resident to share their concerns. The caregiver should then patiently listen without interruption, seeking to understand the resident's perspective before offering solutions or redirecting the conversation. This iterative process of observation, validation, listening, and understanding is crucial for effective and compassionate communication. Question 12. The audit findings indicate a caregiver has expressed discomfort with a client's request to participate in a specific cultural practice during their care, citing personal religious objections. The caregiver is unsure how to proceed while respecting both their own beliefs and the client's rights. Option A. The caregiver should attempt to subtly discourage the client from engaging in the cultural practice by highlighting potential inconveniences or minor risks associated with it. Option B. The caregiver should respectfully communicate the client's request to their supervisor or care manager, explaining their personal reservations, and seek guidance on how to facilitate the client's cultural practice or arrange for alternative support that respects the client's wishes and the caregiver's ethical boundaries. Option C. The caregiver should proceed with the care as usual, ignoring the client's request as it is not a core medical need and may cause personal distress. Option D. The caregiver should politely decline to assist with the cultural practice, explaining that it conflicts with their personal beliefs, and suggest the client find someone else to help them. The correct answer is B. The caregiver should respectfully communicate the client's request to their supervisor or care manager, explaining their personal reservations, and seek guidance on how to facilitate the client's cultural practice or arrange for alternative support that respects the client's wishes and the caregiver's ethical boundaries. Explanation. Scenario analysis. This scenario presents a professional challenge due to the conflict between a caregiver's personal beliefs and the client's expressed wishes, which are within the bounds of ethical care. The audit findings highlight a potential breach of professional responsibility if the caregiver allows personal bias to override the client's autonomy and dignity. Careful judgment is required to navigate this situation, while upholding the core principles of person-centered care and respecting individual rights. Correct approach analysis. The correct approach prioritizes the client's autonomy and right to make informed decisions about their care, even if those decisions differ from the caregiver's personal views. This aligns with the ethical responsibility to provide care that respects the client's values, beliefs, and preferences. Professional practice dictates that caregivers act as advocates for their clients, ensuring their wishes are communicated and respected by the care team and family within legal and safety parameters. This approach upholds the dignity of the individual and fosters a trusting relationship. Incorrect approaches analysis. One incorrect approach involves imposing personal beliefs onto the client's care plan. This violates the ethical principle of respecting client autonomy and can lead to a breakdown in trust, emotional distress for the client, and a failure to provide person-centered care. It may also contravene guidelines on non-discrimination and the right to self-determination. Another incorrect approach is to ignore the client's wishes and proceed with care based solely on the caregiver's interpretation of what is best. This demonstrates a lack of respect for the client's agency and can lead to resentment, non-compliance with care, and a failure to meet the client's actual needs and preferences. It disregards the client's lived experience and their right to be an active participant in their own care. A third incorrect approach is to avoid the situation or delegate the decision-making entirely without proper communication or advocacy for the client. This can result in the client's wishes being overlooked or misunderstood, potentially leading to care that is not aligned with their values or needs. It represents a failure to actively engage in ethical decision-making and client advocacy. Professional reasoning. Professionals should employ a decision-making process that begins with active listening and understanding the client's perspective. This involves acknowledging the client's wishes, exploring the reasons behind them, and assessing any potential risks or benefits in collaboration with the client, and if appropriate, their family or designated representative. If there are concerns about the client's capacity to make decisions or potential harm, the caregiver's responsibility is to report these concerns through established channels, e.g., supervisor, care manager, to ensure appropriate assessment and support, rather than making unilateral decisions or ignoring the client's expressed desires. The ultimate goal is to facilitate care that is both safe and aligned with the client's values and preferences. Question 13. Upon reviewing a client's care plan, you note they have been prescribed a low-sodium diet due to hypertension. The client expresses a strong preference for highly seasoned, salty foods and is resistant to the bland meals they have been receiving. Which of the following approaches best balances the client's preferences with their medical needs? Option A. Consult with the client's physician or a registered dietitian to explore low-sodium seasoning alternatives and preparation methods that can enhance flavor without compromising the dietary restrictions, while also discussing strategies to gradually introduce the client to new tastes. Option B. Accommodate the client's preference for salty foods by preparing their meals with a moderate amount of salt, explaining that occasional deviations are unlikely to cause significant harm. Option C. Prepare meals that are strictly compliant with the low-sodium diet, regardless of the client's expressed preferences, as their health is the absolute priority. Option D. Allow the client to prepare their own meals, as this respects their autonomy and allows them to choose what they eat, even if it contradicts the prescribed diet. The correct answer is A. Consult with the client's physician or a registered dietitian to explore low-sodium seasoning alternatives and preparation methods that can enhance flavor without compromising the dietary restrictions, while also discussing strategies to gradually introduce the client to new tastes. Explanation. This scenario presents a common challenge in caregiving, balancing a client's preferences with their nutritional and medical needs, especially when those needs are complex and require specialized dietary considerations. The professional caregiver must navigate the client's autonomy and desire for familiar foods against the critical importance of adhering to prescribed dietary guidelines to prevent adverse health outcomes. This requires careful communication, understanding of the client's condition, and knowledge of appropriate food preparation techniques. The correct approach prioritizes the client's health and safety by ensuring all meals align with the prescribed dietary plan, while still seeking to make the meals appealing and enjoyable. This demonstrates best professional practice by respecting the client's dignity and preferences within the boundaries of safe and effective care. It involves proactive communication with healthcare providers or dietitians to understand the nuances of the dietary restrictions and to explore acceptable alternatives that meet both nutritional requirements and the client's taste. This aligns with ethical principles of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm. An incorrect approach that disregards the prescribed dietary plan, even with the client's consent, represents a significant ethical and regulatory failure. It violates the caregiver's responsibility to provide safe and appropriate care, potentially leading to serious health complications for the client. This could be seen as negligence and a breach of professional duty. Another incorrect approach that rigidly adheres to the plan without any attempt to make meals palatable or enjoyable, while technically safe, fails to uphold the client's quality of life and dignity. This could be considered a failure in compassionate care and a lack of understanding of the holistic needs of the client. Professionals should approach such situations by first thoroughly understanding the client's medical condition and the specific dietary recommendations from their healthcare team. This should be followed by open and empathetic communication with the client to understand their preferences and any challenges they face with the prescribed diet. The caregiver should then collaborate with the healthcare team to identify suitable food options and preparation methods that meet both medical requirements and client satisfaction. Documentation of all discussions and decisions is also crucial. Question 14. During the evaluation of a new client, a caregiver learns that the client's cultural background dictates specific dietary restrictions that are not aligned with the standard meal plan recommended for their medical condition. The caregiver observes that the client appears hesitant to discuss these restrictions further. What is the most appropriate approach for the caregiver to take? Option A. Inform the client that their cultural dietary practices cannot be accommodated due to medical necessity and proceed with the standard meal plan to ensure their health. Option B. Suggest the client consult with a religious leader or elder from their community to determine how to reconcile their beliefs with the prescribed medical diet. Option C. Assume the client will eventually adapt to the standard meal plan and focus on other aspects of care, as dietary needs are secondary to medical requirements. Option D. Gently inquire further about the client's cultural dietary practices and explore how these might be incorporated into or adapted for their meal plan, while also discussing the medical necessity of certain nutritional components. The correct answer is D. Gently inquire further about the client's cultural dietary practices and explore how these might be incorporated into or adapted for their meal plan, while also discussing the medical necessity of certain nutritional components. Explanation. This scenario is professionally challenging because it requires the caregiver to navigate a potential conflict between established care practices and the client's deeply held cultural beliefs, which could impact their well-being and adherence to care plans. A careful judgment is required to ensure the client's dignity and autonomy are respected while still providing safe and effective care. The correct approach represents best professional practice because it prioritizes open communication and collaborative problem solving. By actively seeking to understand the client's cultural perspective and involving them in finding a solution that respects their beliefs and meets their care needs, the caregiver upholds ethical principles of autonomy, beneficence, and respect for persons. This aligns with the core tenets of culturally competent care, which emphasize acknowledging and valuing diverse backgrounds and tailoring care accordingly. This approach also implicitly follows guidelines that mandate patient-centered care and informed consent, ensuring the client is an active participant in their own care decisions. An incorrect approach that dismisses the client's cultural beliefs as irrelevant or a barrier to care represents a failure in cultural competence. This can lead to a breakdown in the therapeutic relationship, decreased client trust, and potential non-adherence to care, thereby violating the principle of beneficence. Ethically, it demonstrates a lack of respect for the client's autonomy and dignity. Another incorrect approach that imposes the caregiver's own cultural norms or assumptions onto the client is equally problematic. This can be perceived as judgmental and disrespectful, creating a hostile care environment and potentially causing distress. It fails to recognize the diversity of human experience and the importance of individual cultural contexts in health and well-being. Professionals should use a decision-making framework that begins with active listening and empathetic inquiry. When faced with a cultural difference that impacts care, the first step is to understand the client's perspective without judgment. This involves asking open-ended questions to explore the meaning and significance of their beliefs. Following this, the professional should assess the potential impact of these beliefs on the care plan and identify any safety concerns. The next step is to collaboratively explore potential modifications to the care plan that can accommodate the cultural practice while still ensuring safety and effectiveness. This might involve consulting with family members, cultural liaisons, or supervisors if necessary. The ultimate goal is to find a mutually agreeable solution that respects the client's cultural identity and promotes their overall well-being. Question 15. Strategic planning requires a caregiver to anticipate potential emergencies and have a clear, actionable plan for responding to a client experiencing a sudden collapse and unresponsiveness. If a caregiver finds a client unresponsive and not breathing normally, what is the most appropriate immediate course of action according to standard emergency response protocols? Option A. Immediately begin chest compressions and administer rescue breaths as per CPR guidelines, then call for emergency medical services. Option B. Attempt to administer the client's prescribed pain medication, believing it might alleviate the unresponsiveness, and then call for help. Option C. Try to rouse the client by shaking them vigorously and speaking loudly for several minutes before calling emergency medical services. Option D. First, search the client's immediate surroundings for a medical alert device or emergency contact information before initiating any life-saving measures. The correct answer is A. Immediately begin chest compressions and administer rescue breaths as per CPR guidelines, then call for emergency medical services. Explanation: this scenario is professionally challenging because it demands immediate, life-saving action under pressure, where a caregiver's swift and correct response can directly impact a client's survival and well-being. The caregiver must balance the urgency of the situation with the need to follow established protocols, ensuring both effective intervention and adherence to legal and ethical standards. The correct approach represents best professional practice because it prioritizes immediate, evidence-based intervention while also ensuring proper notification and documentation, aligning with the core principles of emergency response and caregiver responsibility. This approach demonstrates competence in CPR and first aid, a commitment to client safety, and adherence to regulatory requirements for reporting and continuity of care. Following established emergency response protocols, such as those outlined in the Caregiver Certification course, is a legal and ethical imperative. An incorrect approach that involves delaying CPR to first search for a medical alert device is a significant regulatory and ethical failure. This delay directly contravenes the immediate need for chest compressions in cases of cardiac arrest, as per CPR guidelines, potentially leading to irreversible harm or death. It also demonstrates a lack of understanding of emergency priorities and a failure to act decisively in a life-threatening situation. Another incorrect approach, such as administering medication without a doctor's order during an emergency, is a severe ethical and regulatory violation. Caregivers are typically not authorized to prescribe or administer medication outside of a pre-approved care plan, and doing so in an emergency without explicit medical direction constitutes practicing medicine without a license and can have dangerous, unintended consequences. A third incorrect approach, which is to only call emergency services after attempting to manage the situation alone for an extended period, represents a failure to recognize the severity of the emergency and a delay in accessing professional medical help. This delay can significantly worsen the client's prognosis and is a breach of the caregiver's duty of care to ensure timely and appropriate medical intervention. Professionals should use a decision-making framework that prioritizes immediate life-saving interventions based on established protocols, followed by appropriate notification and documentation. This involves a rapid assessment of the situation, immediate initiation of CPR if indicated, calling for advanced medical help, and then proceeding with other necessary steps as per training and client care plans. This systematic approach ensures that the most critical actions are taken first, maximizing the chances of a positive outcome while remaining within the scope of practice and regulatory guidelines. Question 16. Consider a scenario where an elderly client who uses a walker for ambulation but has significant weakness in their left arm expresses a strong desire to be transferred from their armchair to their bed using only their own strength. Despite the caregiver's assessment that this poses a high risk of a fall due to their unilateral weakness, the client insists they don't want to be a bother and refuses any mechanical assistance or direct physical support beyond verbal cues. What is the most appropriate course of action for the caregiver? Option A. Allow the client to attempt the transfer independently as they wish, as respecting their autonomy is paramount, and intervene only if they are actively falling. Option B. Physically assist the client into the bed regardless of their verbal objections, as the caregiver's primary responsibility is to prevent harm. Option C. Gently explain the risks of attempting the transfer independently. Explore alternative safe transfer methods that involve the caregiver's assistance and potentially assistive devices, and collaboratively problem-solve with the client to find a solution that respects their dignity and ensures their safety. Option D. Inform the client that the transfer cannot be safely performed and leave them in the armchair until a family member or another caregiver can assist. Correct answer is C. Gently explain the risks of attempting the transfer independently. Explore alternative safe transfer methods that involve the caregiver's assistance and potentially assistive devices, and collaboratively problem-solve with the client to find a solution that respects their dignity and ensures their safety. Explanation. This scenario presents a common ethical and practical challenge in caregiving, balancing a client's expressed preference with their safety and the caregiver's professional responsibility. The core conflict lies between respecting client autonomy and ensuring their well-being, particularly when a client's request might lead to harm. The correct approach prioritizes the client's safety and dignity while actively seeking a collaborative solution. This aligns with the ethical principles of beneficence, acting in the client's best interest and non-maleficence, avoiding harm, which are foundational in caregiver practice. It also upholds the principle of respect for autonomy by involving the client in problem-solving and seeking their consent for alternative methods. Regulatory frameworks for caregiver certification typically emphasize person-centered care, which includes understanding and accommodating client preferences within safe parameters. This approach demonstrates professional judgment by assessing the risk, communicating effectively, and seeking appropriate support, thereby preventing potential injury and maintaining a trusting relationship. An incorrect approach that disregards the client's stated preference without adequate explanation or alternative solutions fails to uphold the principle of respect for autonomy. It can lead to a breakdown in trust and a feeling of disempowerment for the client. Furthermore, if this disregard leads to a fall or injury, the caregiver could be held liable for negligence, violating the duty of care. Another incorrect approach that involves forcing the client into a transfer against their will or without proper consent is a direct violation of their personal boundaries and dignity. This constitutes a form of abuse or neglect, which is strictly prohibited by all caregiver regulations and ethical codes. It disregards the client's right to self-determination and can cause significant emotional distress and physical harm. A third incorrect approach that involves abandoning the task or refusing to assist without attempting to find a safe alternative or seeking help is a failure to fulfill professional duties. Caregivers are expected to provide assistance and support. Simply refusing to engage with a challenging situation without exploring solutions or escalating it appropriately is unprofessional and can leave the client vulnerable and unsupported, potentially leading to harm. The professional decision-making process in such situations should involve a rapid risk assessment, open and empathetic communication with the client to understand their concerns, exploration of alternative safe techniques or assistive devices, consultation with supervisors or other healthcare professionals if necessary, and documentation of the situation and the chosen course of action. The ultimate goal is to provide safe, dignified, and person-centered care. Question 17. The review process indicates a fire has broken out in the kitchen of the residence where you are providing care. Smoke is visible and the smoke alarm is sounding. Your client, who has mobility issues, is in the living room. What is the most appropriate immediate action to take? Option A. Go to the nearest phone to call emergency services before attending to your client. Option B. Evacuate yourself from the residence to ensure your own safety before calling for help. Option C. Immediately assist your client to the nearest safe exit, following established evacuation routes. Option D. Attempt to locate the source of the fire and extinguish it using available fire extinguishers. The correct answer is C. Immediately assist your client to the nearest safe exit, following established evacuation routes. Explanation. Scenario analysis. This scenario is professionally challenging because it requires immediate, life-or-death decision-making under extreme stress. The caregiver must balance the immediate safety of the client with the need to follow established protocols, all while the situation is rapidly evolving. The presence of a fire introduces a high degree of urgency and potential for panic, making clear, rational thought paramount. The caregiver's primary responsibility is the client's well-being, which includes ensuring their safe evacuation. Correct approach analysis. The correct approach prioritizes the client's immediate safety and follows established emergency protocols. This aligns with the fundamental ethical duty of care and the regulatory requirements for fire safety and evacuation procedures mandated by caregiver certification standards. Specifically, these standards emphasize immediate action to remove the client from danger, followed by activating emergency services and alerting others. This systematic approach ensures that the most vulnerable individual is protected first, minimizing risk of harm. Incorrect approaches analysis. One incorrect approach involves attempting to extinguish the fire before ensuring the client's evacuation. This is a critical failure because it delays the client's removal from a life-threatening environment and places the caregiver at undue risk, potentially incapacitating them and leaving the client unprotected. Regulatory frameworks for caregiver safety and emergency preparedness strictly prohibit prioritizing property over human life in such situations. Another incorrect approach is to evacuate oneself first and then attempt to alert others. This violates the primary duty of care to the client. The caregiver's responsibility is to the client under their direct care. Leaving the client to fend for themselves, even for a short period, is a severe ethical breach and a direct contravention of emergency evacuation protocols that mandate assisting those who are dependent. A third incorrect approach is to wait for instructions from others or for the fire to become more severe before acting. This demonstrates a lack of initiative and a failure to recognize the immediate danger. Emergency protocols are designed for proactive response, not reactive waiting. Delays in evacuation can lead to smoke inhalation, burns, or entrapment, all of which are preventable with prompt action. This approach fails to meet the standard of care expected of a certified caregiver. Professional reasoning. Professionals should employ a decision-making framework that prioritizes immediate threat assessment and client safety. This involves 1. Recognizing the emergency. Immediately identify the fire as a critical threat. 2. Prioritize life. The client's safety is the absolute priority. 3. Execute evacuation plan. Follow predetermined evacuation routes and procedures for assisting the client. 4. Alert emergency services. Once the client is in a safe location, call for professional help. 5. Inform others. Notify other residents or staff if applicable. This structured approach ensures that all critical steps are taken in the correct order, maximizing the chances of a safe outcome. Question 18. Which approach would be most appropriate for a caregiver to take when a client, who recently started a new blood pressure medication, reports feeling dizzy and lightheaded shortly after administration? Option A. Suggest the client stop taking the new medication until their next doctor's appointment to see if the symptoms improve. Option B. Immediately report the client's symptoms and observations to the supervising nurse or physician, providing specific details about the timing of the medication and the reported symptoms. Option C. Advise the client to rest and drink water, assuming the symptoms are temporary and will resolve on their own without further intervention. Option D. Document the reported symptoms in the client's chart but wait until the end of the shift to report them to the nurse, as the client has a history of occasional dizziness. The correct answer is B. Immediately report the client's symptoms and observations to the supervising nurse or physician, providing specific details about the timing of the medication and the reported symptoms. Explanation. This scenario presents a common yet critical challenge in medication management: identifying and responding to potential adverse drug reactions. The professional challenge lies in the caregiver's responsibility to not only administer medication as prescribed, but also to observe for and report any deviations from the client's normal state, which could indicate a side effect. This requires keen observation skills, an understanding of common medication side effects, and adherence to established protocols for reporting. The correct approach represents best professional practice because it prioritizes client safety and adheres to the fundamental principles of responsible medication administration and monitoring. This involves immediate, direct observation of the client, followed by prompt and accurate reporting to the appropriate healthcare professional. This aligns with the ethical duty of care and the regulatory requirement for caregivers to act in the best interest of the client, which includes vigilant monitoring for adverse effects and ensuring timely medical intervention. An incorrect approach that involves delaying reporting or attempting to self-diagnose the issue fails to meet the standard of care. Delaying reporting can lead to a worsening of the client's condition, potentially causing significant harm. Attempting to self-diagnose is outside the scope of practice for a caregiver and can lead to misinterpretation of symptoms, delaying appropriate medical assessment and treatment. Another incorrect approach, such as dismissing the client's complaints without further investigation, demonstrates a lack of attentiveness and a failure to uphold the duty of care, potentially violating regulations regarding client well-being and reporting of changes in condition. Professionals should employ a decision-making framework that begins with recognizing a change in the client's condition or reported symptoms. This is followed by direct observation and assessment of the client's current state. Next, the professional must consult available resources, such as medication administration records and known side effect profiles, to form a hypothesis. Crucially, the next step is to report these findings and observations promptly to the supervising nurse or physician, providing clear and concise information. Finally, the professional should follow up as directed and continue to monitor the client. Question 19. Quality control measures reveal that a caregiver is providing excellent physical care to a client who has recently been diagnosed with a chronic illness and is expressing feelings of hopelessness and withdrawing from social interaction. The caregiver is unsure how to best respond to the client's emotional state. Which of the following approaches demonstrates the most appropriate professional response to the client's mental health and emotional support needs. Option A. Acknowledge the client's feelings of hopelessness and validate their distress, offering a listening ear and gently encouraging participation in activities they once enjoyed. Option B. Immediately contact the client's physician to report the client's feelings of hopelessness and request medication to alleviate their mood. Option C. Advise the client that their feelings are a normal part of adjusting to the illness and encourage them to think positive to overcome their sadness. Option D. Focus exclusively on the client's physical care needs, ensuring all medical tasks are completed efficiently, and avoid discussing emotional topics to prevent upsetting the client further. The correct answer is A. Acknowledge the client's feelings of hopelessness and validate their distress, offering a listening ear and gently encouraging participation in activities they once enjoyed. Explanation: this scenario presents a professional challenge because it requires a caregiver to navigate the delicate balance between providing practical assistance and offering emotional support to a client experiencing a significant life change. The client's withdrawal and expressions of hopelessness, while potentially stemming from a medical condition, also indicate a need for emotional validation and connection. A caregiver's role extends beyond physical care to encompass fostering a sense of well-being and dignity, which is particularly crucial when a client is facing a loss of independence or a significant health diagnosis. Careful judgment is required to respond in a way that is both supportive and respects the client's autonomy and emotional state, adhering to professional boundaries and ethical guidelines. The correct approach represents best professional practice because it prioritizes active listening, empathy, and validation of the client's feelings. By acknowledging the client's distress and offering a safe space for them to express themselves without judgment, the caregiver builds trust and strengthens the therapeutic relationship. This aligns with the ethical principles of person-centered care, which emphasize respecting the individual's dignity, autonomy, and emotional needs. Furthermore, by gently encouraging engagement in activities that were previously enjoyed, the caregiver is promoting the client's overall well-being and potentially mitigating feelings of isolation and despair, in line with the goals of supportive care. An incorrect approach that involves dismissing the client's feelings or offering platitudes fails to acknowledge the reality of their emotional experience. This can lead to the client feeling unheard, invalidated, and more isolated, potentially exacerbating their distress. Ethically, this approach violates the principle of beneficence, acting in the client's best interest, by not adequately addressing their emotional needs. Another incorrect approach, such as immediately escalating to a mental health professional without first attempting to engage and understand the client's perspective, might be premature and could be perceived by the client as a lack of confidence in their ability to cope or a failure of the caregiver to provide basic emotional support. While professional consultation is important, it should ideally follow an initial attempt at supportive engagement. An approach that focuses solely on the physical aspects of care, ignoring the client's emotional state, neglects a crucial component of holistic care and can lead to a decline in the client's overall quality of life. Professionals should employ a decision-making process that begins with active observation and listening to understand the client's expressed and unexpressed needs. This is followed by empathetic validation of their feelings, demonstrating that their emotions are understood and accepted. Next, the caregiver should assess the situation to determine the appropriate level of intervention, considering their scope of practice and the client's immediate needs. This might involve offering comfort, encouraging communication, or facilitating engagement in supportive activities. If the client's distress is severe or persistent, or if there are concerns about their safety, then escalating to a supervisor or appropriate mental health professional becomes necessary. But this decision should be informed by the initial supportive engagement. Question 20. The assessment process reveals that a client who has been prescribed a new medication for a chronic condition is refusing to take it, stating they don't like the taste. The caregiver has observed that the client is otherwise alert, oriented, and appears to understand the purpose of the medication. What is the most appropriate course of action for the caregiver? Option A. Attempt to disguise the medication in food or drink without informing the client or the supervising nurse to ensure they receive it. Option B. Respect the client's refusal and do not administer the medication, as the client has the right to refuse any treatment. Option C. Administer the medication as prescribed, explaining to the client that it is necessary for their health and that their preference for taste cannot override medical necessity. Option D. Document the client's refusal and the stated reason. Then inform the supervising nurse of the situation for further assessment and guidance. The correct answer is D. Document the client's refusal and the stated reason. Then inform the supervising nurse of the situation for further assessment and guidance. Explanation. This scenario presents a common ethical challenge for caregivers where a client's stated preference conflicts with what appears to be medically beneficial or standard practice. The professional challenge lies in balancing client autonomy with the caregiver's duty of care and the need to ensure the client's well-being, all within the established regulatory framework for caregiver certification. Careful judgment is required to navigate this conflict without overstepping professional boundaries or neglecting the client's rights. The correct approach involves respecting the client's decision-making capacity while also ensuring they are fully informed and that their safety is not compromised. This aligns with the ethical principle of autonomy, which is fundamental in person-centered care. It also adheres to the regulatory guidelines that emphasize informed consent and the right of individuals to make choices about their own care, provided they have the capacity to do so. By seeking clarification from the supervising nurse, the caregiver ensures that the client's wishes are understood in the context of their medical condition, and that any potential risks are properly assessed and managed by a qualified healthcare professional. This collaborative approach upholds both ethical standards and regulatory compliance. An incorrect approach would be to disregard the client's stated preference and administer the medication as the caregiver believes is best. This violates the client's right to autonomy and informed consent, potentially leading to a breach of trust and regulatory noncompliance. Another incorrect approach would be to simply document the refusal without further investigation or communication with the supervising nurse. This could be seen as a failure to adequately assess the situation and ensure the client's safety, as the underlying reason for the refusal might be a misunderstanding or a symptom that requires medical attention. Forcing the medication or coercing the client into taking it would be a severe ethical and regulatory violation, constituting battery and a complete disregard for the client's rights. Professionals should approach such situations by first assessing the client's capacity to make the decision. If the client appears to have capacity, the caregiver should engage in open communication to understand the reasons behind the refusal. This includes asking clarifying questions about their concerns or preferences. If the refusal is based on a misunderstanding or if there are potential health implications, the caregiver's next step should be to report the situation to their supervisor or the designated healthcare professional, e.g., supervising nurse, for further assessment and guidance. This ensures that the client's care plan is reviewed and adjusted appropriately, respecting their autonomy while maintaining professional responsibility and adherence to regulations.